what a piece of music, and it can only mean one thing. That's right, it's that time of the week again for another episode of Burying Fake News. First and foremost, top of the show, huge thank you to all the fine folk, you know who you are, who downloaded and got involved with last week's show, the Legion of Lewis, Marielle's Militia, the Battalion of Burying Fake News. All 6 of you are welcome to over my house for dinner. We're available all over the internet. Tell your friends, try the waitress, tip the veal. But so those of you who are new to the show, my name's Lewis. I'm the soon-to-be Dr. G. This is Burying Fake News. This is the show for the every man, the every woman, the every person out there to have access to scientific knowledge so they can just beat, berate, break down, and destroy their shitty social media posts that ruin your time online. And as ever, to join me in this crusade, it's my missus, my carer, the boss, Lefa, the queen of Burying Fake News. She doesn't choose her favourite tweet of the week in advance and takes so much time. Part-time interpreter, full-time chief problem wrangler at Mrs. Norris's finishing school for bad eggs is Mariella. Mariella, welcome back to yet another episode of Burying Fake News.
Oh, I'm happy to be here.
Well, you could have said that with some spunk in you, woman.
Well, I want something short and sweet.
Well, it was definitely short.
Well, I wanted to keep it short and sweet, to make up for all the time that I spend making up my mind about tweet of the week.
Well, do better. This week, top of the show, some very important housekeeping. We have no shout-outs, no new followers. If you're listening to this and you're on YouTube, give us a follow, a like, a subscribe, and you get your shout-out, which is really important for your own kudos and will make you feel really good.
Well, yeah, given that, you remember their names.
No, I don't remember the names. I wrote them down.
Oh, good. Okay. But absolutely.
If I don't write them down, I forget.
Yeah, I believe that. So no housekeeping.
No, we can just get straight to the meat and potatoes of the show.
Awesome. Today we're talking about something very interesting, I think very relevant. Let's go.
Right, this week, meat and potatoes, sweetie. What are we talking about this week?
I believe we're going to talk about the R0 number and what it means and, what it actually means in context.
What do you know about the R number?
Not much. It's something I very recently, sort of, heard after the whole coronavirus outbreak. And as far as I know, it's kind of how we can measure how quickly something spreads. It's seems to be jargon from epidemiology and these infectious disease experts. And it was really cool. I've never heard of it before, and I think it's very illustrative of how virulent, things can be or are not.
Well, it's not a bad summary. So, rewind back to May. Mathematicians and public health experts really watched and winced with their kind of screwed up faces as in the UK we had British Prime Minister Boris Johnson unveiled a series of charts to explain how the government would guide Britain out of coronavirus lockdown. And the most prominent and colourful dial with a big needle hovering near a single digit, 1. This dial indicated R, a now, as you say, totemic figure in the COVID-19 pandemic, really brought to life through COVID. Johnson said the nation would set a COVID-19 alert level and would be, I believe this is a direct quote, primarily determined by the number of coronavirus cases and by R, the reproduction number. To infectious disease experts, Johnson's focus on the reproduction number as a guide, as a guiding light for policy was very myopic. They worried that placing too much weight on R, which was the average number of people each person with the disease goes on to infect. Right? So they worried about placing too much weight on R, the average number of people each person with the disease goes on to infect. And it's quite interesting, as you said, during this pandemic, R, this concept of R, has just transcended from pages of academic journals into day-to-day conversation by politicians, by newspapers, and by people, me and you, and podcasts, and framed as a number that will shape everybody's lives. Germany's Chancellor Angela Merkel explained in a video in April, which was all over the place, that an R above 1 means an outbreak is growing, and below 1 it means that it is shrinking. In many countries, it is publicly reported every week. In June, epidemiologists over at Harvard Chan School of Public Health in Boston, Massachusetts, they announced on their website where they announced a website where anyone can look up the value for any country. And I'll just get that link for you now because it's quite a cool website.
Cool. That's great. I love links and, resources and everything like that with information I can look up myself.
Where's that link gone? So if you go, oh, it's brilliant. So if you go to metrics.covid19-analysis.org, that's metrics.covid19-analysis.org. I'll put the link in the description, I promise. You can go to anywhere in the world and get the R number to date. So as we're recording on the 28th of August, Germany's is between 1.01 and 1.06. The UK between 1.08 and 1.13, not quite as good. In Mexico, baby, you're at 0.93 but 0.95. However, we will get into that why that's perhaps not as good as it seems. And America's between 0.94 and 0.94, which doesn't quite make
No, not at
sense
all.
unless they have some incredibly tight error bars. But regardless, I'll put that link in the description. That's a cool website. And anyone can use that, and
Awesome.
it's free. But this fascination might have turned into or I think it's turned into a really unhealthy political and media fixation. R is an imprecise estimate. It rests on many assumptions. And if you look at work from Jeremy Rossman, who's a virologist out of the University of Kent, who's a really good academic, he says, well, it doesn't capture the current status of an epidemic. It can spike up and down when case numbers are low. It's an average for a population, and therefore it can hide local variations. Too much attention on it, which is kind of what has happened, can obscure the importance of other measures and other trends in numbers of new infections, deaths, and hospital admissions, and cohort surveys to see how many people in the population currently have the disease or have already had it. And a quote that I lifted from Mark Woolhouse, who's an infectious disease expert at the University of Edinburgh, he come to say the quote, Epidemiologists are quite keen on downplaying R, but the politicians seem to have embraced it with enthusiasm. And I agree with this sentiment completely. And this is a man who's a member of the modelling group who advises the British government through this pandemic on how to respond. And he also went on to say that, quote, we're concerned that we've created a monster. R does not tell us what we need to know to manage this. Many policymakers understand this. No one else has linked R so tightly and explicitly to public policy as Boris did. Boris Johnson, UK Prime Minister, lad. And Rossman goes on to say that despite the coloured dial chart, it's not clear how much R is actually driving UK policy, coronavirus policy. And in the weeks after Johnson's announcements, the government didn't reference R again when it took measures to ease restrictions or lower the national level alert. So researchers remain concerned that R is looming too large, is being used for purposes which it was never invented for, and it's not clear what actions they are or are not taking because of the R number. And they are concerned, and myself too as a fellow scientist, that they're giving it just too much prominence.
That's really interesting. Um, you know, it's because we hear it in our daily sort of, I guess, communication now. We kind of start getting some insight into how mathematical models are just that, they're models, right? And while some data that is general can be very helpful to give us an idea of averages, of what we can sort of expect in a very large picture, um, it can also be flawed in the fact that it can be too generalized and not specific enough to drive things like policy. And I think that with what you were saying is that some governments can have sort of try to, you know, have their policies driven by scientific models. But when we kind of limit, into one thing like an R naught number or, a specific model, we kind of realize that it's actually, scientists have a really like very big job. It's a very reductionist view of the bigger picture.
Yeah, it's not fit for purpose. So I'll talk
Yeah.
about the origins of R.
Yeah.
First, it was used about a century ago in demography or demography. R originally measured the reproduction of people to deduce whether a population was growing or not growing. In epidemiology, the same principles apply. It measures the spread of infection within a population. So if R is 2, 2 infected people will on average infect 4 others, who will infect 8 others, and so on and so on. The measure allows modelers to work out the possible extent of the spread, but not the speed at which the infection grows. Unless they are regularly testing an entire country's population, epidemiologists can't measure R directly, so it's usually estimated retrospectively. Disease modelers look at current and previous numbers of cases and deaths, make some assumptions to find infection numbers that could have explained the trend, and then derive R from these assumptions.
Yeah.
One variant of R, which is R naught, assumes that everybody in a population is susceptible to infection. And this usually isn't even true, but it might be when a new virus such as SARS-CoV-2 emerges. So at the start of the pandemic, assessing R naught and other metrics was quite crucial for epidemiologists building models of how the disease may spread. But when politicians and scientists talk about R, they usually mean another variant, which is also called RT, or in some literature, it's called RE, effective R, which is calculated over time as an outbreak progresses and considers how some people might have gained immunity, perhaps because they've survived an infection, become vaccinated, or just genetically fortunate. So RT and R naught both vary with the social dynamics of a given population, which is going to vary from sometimes region to region. Even an easily transmitted virus will have trouble spreading in a region where people rarely meet, like the Highlands. In January, the COVID-19 R naught in Wuhan, in China, was calculated. Where are my notes? Was calculated to be between 2 and 3. After lockdown, estimates put RT in Wuhan just over 1. So there is a lagging phase. So to working out RT involves trade-offs and compromise. Confirmed cases and mortality figures can be used to infer the total numbers of cases and infections, but both come with this lag phase, this significant lag, which scientists estimate could be anything from a week to 3 weeks or more. If you have your RT estimate lagging by 10 days, possibly 2 weeks, then it's not going to be that useful as a real-time decision-making tool.
Yeah. And I think like that's kind of the key, and what I hope that people understand about or take away most from this whole pandemic situation. It's a lot of the information that we have on diseases and like my growing estimation and appreciation for epidemiology, a lot of the research is done in retrospect. It's so hard to manage something that is ongoing. And I even remember, when the virus first came out, everybody in the world was kind of stopping and seeing what it was doing in China. Like, how often do people die? How often are they dying? Are there any specific conditions that are attributed to people dying more than others? And so we were all kind of holding our breath just to see what it was like exactly. And even now, we don't have a very clear idea of what it's doing, because I'm guessing it's because of asymptomatic carriers, especially. And maybe it might be something we might work on it in retrospect.
Yeah, absolutely. So it's the problem comes entirely down to different regional practices and this lag phase, this idea that you're looking at retrospective data. There is a mathematical trick, if you like, that you can use. It's called nowcasting, and it's they use it in economics to see what the stock market might be doing. They also use it in meteorology as well, and they can use the observed statistical distribution of reporting delays to predict how much higher the number of fresh infections will be in, for example, 2 weeks' time. Some estimates of RT already rely on this nowcasting infection data in this way, again, going back to quotes, because you know I love to dig out quotes. Quote, the
Important.
primary source, the method with the least guesses, and that comes from Lars Schad, who's vice president of the Robert Koch Institute in Berlin, Germany. I'll let that joke settle there. And that was Germany's main public health agency, which reports their daily R value or RE value, as well as their 7-day RT value based on infections reported by state health authorities. Right
Mm-hmm.
now, casting infections on the basis of trends in the past is quite tricky, but mortality data comes with an even longer lag because of the extra time someone has the disease before they succumb to it, and because of the paperwork involved in registering deaths, as with anywhere, which can take extra weeks or months to file. So a group led by Sheila Bird over at Cambridge University published nowcast data of COVID-19 deaths in English hospitals, but they can't yet do the same with separate set of deaths compiled by the ONS, which is the British Office of National Statistics, because the Office of National Statistics, sweetie, why can't I say this word right? Compiled by the Office of National. I'll try again.
Try again. Try again. You've got this. You get closer.
Right. A very clever edit because I can say the word statistics, people. Here we go. Compiled by the Office of National Statistics because the researchers don't have access to the necessary data on registration delays and the time difference between when a death occurred and when the ONS reported it. And then there comes with extra uncertainty because an issue with the nowcasting approach or application or mathematical trick is that it swaps one problem for another, essentially. And this is kind of idea is also agreed by Sebastian Funk, who's a disease modeler out of London School of Hygiene and Tropical Medicine, and he's also advising the government. He's a part of the SAGE group who's advising the government on the pandemic now, and they're saying that you can try to do that, but for obvious reasons, it always comes with uncertainty. There's no way that you can know how many cases would still be observed that haven't already been infected.
Wow. Yeah.
Other data on the pandemic's progress can feed into estimates of RT by serving as proxies for infections and social behaviour. One is hospital intensive care admissions, another is results from random tests in other populations, see how many people currently have COVID-19 or have had it. Researchers also conduct contact surveys, which ask people who they mix with, and can be used to infer changes on R on the basis of estimates of how many others an infected person could potentially meet. Although these are also time consuming and could cover relatively small groups or pockets of people. Contact surveys over in China show daily contacts were reduced by 7 to 8-fold during COVID-19 social distancing period when most interactions were restricted to the household. And I do have I do have a citation for that fact as well. Another way to observe trends in people's movements is to use location data based on the signals from mobile phones, which has been published by Facebook and Google. And Funk, who was the tropical medicine man, also goes on to say, well, there's a bit of a trade-off here. There are some methods that are more immediate but not epidemiological, and there are others that are directly epidemiological but at the same time more out of date. So there are groups of epidemiologists that have their own approach to combining and using disparate sources of data to work out RT, relying on their own statistical models to look at trends in presumed infections. To calculate the official RT of the UK, about 10 groups present the results of their models to a dedicated government committee, which reaches a consensus on a possible range given reasonable error bars. The figures are presented in that range. So what was it we said earlier? 0.9 to 1.1 maybe, something like that.
Yeah, I think so.
Showing how uncertain the estimates are, but individual models are not released. So these quote official, because there's nothing official about this average, official RT numbers are not the only versions available. Academic researchers have taken advantage of infection and mortality figures collated by the World Health Organization and independent groups such as the Coronavirus Research Center at Baltimore, Maryland. John Hopkins, there you go, Johns Hopkins in Baltimore, Maryland, to publish their RT figures for numerous countries and states. In late April, for example, the public health researchers in Colombia claimed that RT for the first 10 days of the pandemic was above 2 in 7 Latin American countries. I do have a citation for that as well. The Harvard researchers website estimates that R is above 1 in more than 30 US states. So even non-experts can use plug-and-play formulas to create their own variants of R, which can lead to further problems.
Yeah, it sounds like they kind of use averages of averages of
Yeah,
averages in some cases, and it's, making policies on this.
with assumptions. So in May, local newspapers across England ran stories claiming to reveal regional RT values for specific towns and cities. So the Swindon Advertiser claimed the town's RT was perhaps 0.35, one of the lowest in the UK. But officials at Brighton and Hove City Council, which was labelled the fourth highest RT at 1.7, issued a statement calling the figures misleading and potentially dangerous. Quote, "It is not possible to calculate meaningful R values at a very local level." And that was by Alistair Hill, who's the public health official on the council over there. The figures were not, as it turned out, RT values at all. They all came from an index created by the founders of London-based analytics group startup called DeckZero.com. That index is termed RZ.
Oh, wow.
That was intended to show how fast local epidemics were growing on the basis of case data from local authorities. It's not an established variable in epidemiology.
Oh, wow.
So on the 7th of June, the founders withdrew their page completely from public access and said it had been, quote, interpreted out of context and scope of its original intention. Fucking telling me.
Yeah, and this is why we've got to be very careful with this sort of data. Again, we as a public generally, we can get very limited views on what it means, and there's reasons why people do entire PhDs and entire careers on this. It's not just a number, right?
Absolutely. It's an average, and it does have drawbacks. So an important aspect of RT is that it represents only an average across a region. This average can miss regional clusters of infection. Conversely, high indices of infection among a sparsely distant, smaller subsection of a population can sway larger regions' RT value. And this was what was seen in Germany very recently. Their national RT value jumped from about 1 or just over 1 to nearly 3, 2.8 in late June.
Wow.
I think they'd revised that to 2.17, but that was entirely because of an outbreak in one meat processing plant in Gütersloh. I know I butchered that one. Gütersloh in North Rhine-Westphalia. And Franzi's very annoyed with me somewhere. Not that she listens, she's got better things to do with her time. I'll send her a quick demo.
I hope she messages you.
Hello again, friends. I interrupt this podcast for a short post-production edit for a quick word from our German correspondent, Franzi. I told you she wasn't going to be impressed.
Hi, your pronunciation is really shitty. So it's called Gütersloh. Okay? Again? Gütersloh.
Well, I didn't think she was going to be happy, but thank you for that quick word, Franzi. We appreciate it over here. As do the fine folk who listen to this program. All 6 of them. But going back to the Robert Koch Institute, the Robert Koch Institute noted that national infections overall were still low, which is why the local outbreak had such an effect on the country's RT, which had dropped below 1 again by a couple of weeks later, by the end of June. This makes it unlikely that RT would be used to steer local lockdown policy in Germany. And that, again, is coming from the work from Schad at Robert Koch Institute. I'm going to see how many times I can say cock. We've got to get some cheap laughs in for the audience. If the rolling mean of R, that is the average, was divided by the number of times you take it, was at 1.2 for a few weeks, then it would show there was a problem that needed attention, even if case numbers were low. But in practice, researchers find out about local outbreaks before that because of a reported spike in cases, not because of changes to RT. Germany has ongoing surveillance and public reporting of transmission levels in about 400 of its counties. And that, again, all that information comes from Robert Koch Institute and John Hopkins as well, I might add. More words I've got here. So most experts say that for the RT, the United Kingdom is kept, quote, artificially high by very large numbers of infections and deaths in care homes for older people and does not reliably represent the risk to the general population. And first of all, if you're someone who's lost a loved one to a fucking care home, I think you'd want them to be considered as part of the numbers, really. But I digress. Regional RT numbers have been touted as a way to guide the further easing of restrictions, again talking about the UK, because they could allow a place that showed resurgences in cases to be sealed off. But regional RT numbers become less accurate as they are applied to smaller populations, especially when absolute infections are low. So going back to the Harvard site, which produces the numbers for the US counties, which can range from thousands to millions of inhabitants, depending on where you're talking about, their hyperlocal data comes with huge uncertainties. And that's not just me saying that. That's one of the creators, Jihong Lin, who kind of alluded to this and said the researchers don't calculate for an RT for a county unless there are 10 cases. And Lin goes on to explain that policymakers should not use them in isolation, but only alongside other measures, such as total number of cases and whether that is increasing. When making recommendations, it's important to look at the whole picture and not just rely on this RT, this average. And she also went on to say that used properly, the data could help public health officials identify hotspots of infection and prioritize resources, such as testing. But they're still not accounting for other things, which are misses, and that leads me into super spreaders. Another subtly not captured by RT, and that is people who may never infect others, and there are a few who infect everyone they meet, and they're known as super spreaders. And they pass on disease many, many more times than the average person was, perhaps because they mingle in crowded indoor events where the virus spreads more easily. Maybe they go to church services, choirs, nightclubs. They have big families. They live with children. They live in multi-generational households, and they have large extended family in the street. Blah blah blah. As few as 10 to 20% of infected people seem to cause about 80% of the new cases. And that's, again, using data from Luang's site. Epidemiologists actually describe this using a dispersion parameter called K, but it depicts the variation in viral transmission amongst infected hosts. But that's K is another thing, and it's more maths I don't want to get into. So that means that bans on certain crowded indoor activities could have more benefited than blanket restrictions introduced whenever the RT value hits 1. When countries consider when to reopen schools and offices, as we are doing over here, the key question is not only RT, but what the actual number of infected people walking around is. So Denmark and the UK have similar RT values, for instance, but because the number of infected people walking around Denmark is approximately 10 times lower based on their data, it's safer for their schools to be reopened. And another Woolhouse quote here from Cambridge: when infection numbers are low, maybe you don't care so much about the reproduction number or what the reproduction number is, or at least don't care if there's some uncertainty in it.
That's very
But
interesting.
this will be whether the country overreacts if case numbers are low, but modelers estimate that the R is above 1. So all that demotes the usefulness of R is, in terms of deciding policy, it does. It doesn't disqualify it entirely, but it demotes its helpfulness, its usefulness, and certainly in the United Kingdom, I think the general consensus is that it's far more important to watch clusters of cases and set up comprehensive systems in place to test and trace contacts and isolate those infected than just to watch this needle swinging back and forth on our fucking colourful dial of an average, which is not representative.
Yeah, absolutely. There is so much information. I'm still trying to process all of it. But, while I can't comment on specific bits, I think, like, in general, what we're seeing is we have a very useful tool, and mathematical modeling is so useful, and it's probably, more accurate than we think it is. But when it's used in isolation, or we only pick and choose what bits we actually implement, it can lack a lot of perspective, and it can lack a lot of information that's vital for making decisions too. Once more, seeing kind of like this break
Absolutely.
between academics and people who know, and policymakers and action takers. And I think, like, you've talked about the UK. I think a big issue with Mexico was, and this is a bit of a rant complaining about how it's been handled, is that we've had good epidemiologists and scientists talk to us about our case. But what always would bother me about what they would say is that early on in the outbreak, they said, this is what the model looks like. The peak will be, a month from now. And obviously, as time went on, they would move that peak, to the next month, and 2 more weeks, and the next month. And I was thinking this whole time, mathematical modeling also can take into account behaviors, but only to a certain extent. It's assuming that things stay constant. It's assuming that everybody behaves on Mother's Day, where everybody just went out and, saw their mothers, and of course we saw a spike in cases 2 weeks later. Um, and this is where we have to be careful about exposing, these very specific bits of knowledge to the general public, because a lot of time, in the attempt to reduce them and make them simple to understand, we end up just reducing what it actually means and all the assumptions, like you were saying, that we make along with them. So, like you said, it's not
Correct.
just a little dial that goes up and down that we have to be looking for. And we probably need to be looking at more things and different aspects of the pandemic to be evaluating what we should be doing next as a society and as a government.
I agree. And speaking about what we should be doing next, I think we should move on to our next part. But before I do, I did say I had a few citations. So I used three sources, and I just want to let the people know where I got a lot of my
Awesome.
information from for this
We love
episode so they
citations.
too can share it. Most people wouldn't give a flying fuck, but there might be some hardcore listeners out there. So the first one I got was from the Lancet, and this was from Kucharski et al., Lancet, volume 20, 553 to 558 of 2020, and it is the early dynamics of transmission and control of COVID-19, a mathematical modeling study. So if you just either search Kucharski et al., Lancet, or you just search early dynamics of transmission and control of COVID-19, a mathematical modeling study, that in the Lancet will give you the paper there that they used and what they found, and they declined in Wuhan during late January, and it was that kind of data that I was pulling on. The other citation that I used, and this was a science paper, another 2020 paper, and it was changes in contact patterns shape the dynamics of the COVID-19 outbreak in China. And I also used a paper from the International Journal of Infectious Diseases, and it was effective reproductive number estimation for initial stage of COVID-19 pandemic in Latin American countries. Those were my three citations that I used to draw on this, as well as a bit of Googling here and there, and institutional sites like the Robert Koch Institute, John Hopkins University, that website I'm going to link, the metrics.covid19-analysis.org, whatever it is, link in the description, go check it out.
Awesome.
But with that being said, it's time to move on to my favourite. I'm going to get it right this week. The quickfire, not so quickfire, but sometimes quickfire round.
Good job. I think we had enough with the statistics.
I'm going to say it one more time for effect. Quickfire, not so quickfire. It's not a quickfire round. Math sucks, but it's very important.
All right, so here are the questions for our quickfire, not so quickfire, but sometimes quickfire round. This might be a quick one, it might not be, because I think there's some pretty interesting questions here. All right, number one. So, how is the R number calculated? What's the formula?
Oh, the formula is. I don't know what the formula is. I can tell you how it's done. I don't know what the fucking formula is. The thing is, right, okay, so the formula, as I said, there is more than R. There's R naught, there's RT, there's RE, and there's RZ. Everyone who has their own model has their own way to calculate it.
Okay, and there's no like several like generalized sort of formula that we can plug in, number of cases over number of, I don't know.
No, it's an imprecise estimate that rests on assumptions, and the assumptions will change depending on who's making the modeling and where they are. Someone who's in China who sees how the people of China behave with each other in a city may be different to the people in a Chinese village out somewhere to a UK city to a UK village somewhere.
All right, number two, and I think this one could be pretty interesting. What illness has the highest or some of the highest R numbers that we know?
I don't know if this is a fair question because the plague had a wonderful transmission rate, but it was at a time when people didn't understand how not to get the plague.
As far as I know, so far it's measles, and I think their R number is like 15 or something like that. It's something very insane. Equally, this is why we do this sort of research in retrospect, and why we definitely vaccinate people for it, because it is very, very, very contagious.
Well, thank God we have a vaccine for it.
Yeah, yeah. So that's the only one that I know of that was like astonishingly high. There was several others that I know are higher, but I'm not too sure what they are.
I wouldn't know without looking or without googling, but I mean, if we're going to be talking out loud very quickly, the flu, pneumonia, I would say, they can have not maybe a hugely high R rate, but freshers, flu, everyone seems to get that at the same kind of time.
Well,
So,
one of the questions is actually, the common flu. How? What's the R?
what's the R rate of the common flu?
Yeah. Well, I've got it up now. It's
So I've got it up as
all
well. So
right.
the R naught,
Mm-hmm.
which is the value for it, is about 1.3.
All right, so it's actually not as severe as I thought it'd be. There's some really interesting ones up here. I don't know if you and I are both looking at the same page. Number one is measles, with an R naught number of between 12 and 18, something that we do vaccinate for. Second of all is chicken pox, something you can also get vaccinated for. That is 10 and 12. And then we've got mumps, that's similar, 10 and 12. Polio,
All the
rubella,
childhood
pertussis.
diseases.
Yeah, and these are things that, again, I think because we don't see it as much, we kind of forget how, common we kind of live with disease in general. So,
Yeah.
but
Did you ever have chicken pox as a kid?
no, I was vaccinated.
I wasn't vaccinated, but I never got it.
Oh gosh, well now you're just frightening me. But no, I was vaccinated against everything that there was possibly a vaccine for. But I know it's a very common practice that, when somebody gets chickenpox, you kind of crowd them together to make sure that you get it as a kid. Because it's so highly infectious, right? So these are really infectious diseases that we are looking at. And the one that surprised me the most was Ebola, that actually has an R naught of 1.5 to
It's low.
1.9. Yeah, it's relatively low because
Yeah.
of how it's transmitted, right? The ones with the highest are not are airborne, which is like really problematic because somebody can walk into a store and 2 hours later the virus is still hanging around. And then we've got respiratory droplets, could be like a COVID sort of thing, and then we've got like body fluids and stuff like that, direct contact with the people. So I thought that was quite interesting.
Yeah, it's like cholera. I can't imagine that having a high R rate.
Yeah, and it's like really specific circumstances too.
Yeah.
So, one of those. What is the lowest possible R number there is? Could it just get to zero?
Well, yes, of course. You get to a point where the virus doesn't move, people move. So if people stop moving, it'll get to a point where the virus is burnt out, that it is no longer viable.
But there's no like virus I could imagine with, an actual transmissibility of like 0 unless it's like not a virus. Does that make any sense?
Well, no, it wouldn't exist. We wouldn't
Yeah.
know about it because no one would have it.
Yeah, that's what I figured. All right.
I'll let you rethink that comment.
It was because I was thinking, like,
I'll let you ponder further
well, no,
about what the words have just come out of your mouth.
for example,
I've been trying to think about math all day, and now I'm met with this. Oh.
well, no, because I'm thinking, for example, it says here MERS is between 0.3 and 0.8. Like, could it get to a point? Could you get like some sort of disease that was so mortal, for example, that the second you got it, it would kill you and it wouldn't reproduce, but it's still a virus.
Well,
So
no, think of it the other way. MERS is low, but it's also 0 because we we don't have it anymore.
it's
You
still
know,
an
like,
endemic in some parts of like the Arab world, I think.
well, think of it the other way around with measles, how high that is, but who has that?
Yeah, yeah. Well, if you don't vaccinate your kids, you definitely will have
So,
that. All right,
well,
and
we can get on to that in another episode.
absolutely. Still, vaccinate your kids, please. And the last question is: do we have other ways to calculate transmissibility or reproduction rates in the virus?
Yes, but whichever approach you take to model it, you have to sacrifice some aspect of it, whether it's a lag phase or whether it's assumptions of personal relations or interpersonal relations. The best thing to do is to use it as well as other data. Use it as well as new infection. Use it as well as a track and trace system. But as a standalone value to dictate policy, it's just not fit for purpose.
All right, so everything in context, basically.
Which is the message I was trying to get over earlier.
Absolutely.
I'm not happy about our country's decisions being guided by a fucking average with a lag phase on it. And the more you go into the maths, you realise how poor it really is as an indicator. But we're not a political show, so whatever.
No, and I think like somebody like we need to realize that again, this is science being done live, and this is just part of the process. We're still learning so much about everything, and
Oh God, absolutely! Every time the government changes their mind and the media come out and goes, "It's a U-turn, it's a U-turn." That's science. That's what you do. You can't just keep doing the same thing if it's proven that it's not good. It's
well,
not a bad thing to
there are
change your mind.
definitely
I will
bad
believe
decisions
anything.
out there.
I will believe.
Saying you have conditions
I will
to go
believe
back to
anything with
school.
evidence.
I
Anything.
don't. Yeah. It is partially
Independent
true.
evidence.
Partially true. I think
And the more ridiculous it is, I have to believe, the more firmer that evidence has to be. But if it's there, then it's there.
yeah, and I hope that
There's nothing wrong with having a hypothesis and then having to change it because it was wrong. That is science in action.
yes. And the problem that we have here is that it's people's lives, being affected by it. But a little patience, and hopefully a couple of years, we have a better idea of what happened and going forward how we can handle things better.
Does that sum up our quickfire, not so nice quickfire round?
That's the end of it.
Good. So if you do have any questions, COVID or not, science related, no questions too stupid, send them over, buryingfakenews@gmail.com. Links in the description below, along with that site from earlier. But now it's time for us to move on to arguably the only reason we keep on doing this show. You all know what time it is, sweetie. Tell the people what it is.
It is time for a tweet of the week. The reason I do this show. All right, let's get into it. Play that funky music, white boy.
Oh my god, that music can only mean one thing. It's tweet of the week. This is the part of the show where we scour social media for the most stupid, backward, inbred, drool, knuckle dragging tweets that you can find, and Facebook posts and other social media areas from people who just don't understand science, don't believe science. What do they call themselves? We're the sheeple, is it?
The sheeple, yes.
Those people, you know they are. They've got hashtag 2A and MAGA, and they've all got fucking flags and shit in their pictures and God and blah blah blah. And with that being said, sweetie, you've got me in front of us. Kick us off for number one.
All right, number one says our number complete hogwash. So-called scientists, so-called experts don't know anything. Me and my cat discussed this last night. He told me he only knows one person for 8 months who has had so-called COVID, and then it was just cough, which went away. I had to read that one several times. Me and my cat.
Compelling stuff.
My cat. I wonder what his cat
Yeah,
says.
I think that's an autocorrect error. It has to be an autocorrect error. Like, I'm not sure how, but yeah, me and my pussy just chilling.
Oh my god, I wrote my cat. Oh, your cat must have some insightful things to say about the situation then.
Bloody cats. Number two. I'd believe it if he did a dog. Number two. It's strange how they don't need the R number anymore to lock places down and continue with their rules, masks and SD, etc. The great pandemic hoax.
Oh my gosh. What's SD?
Smackdown? I'd have no idea what SD is.
I don't know if it's Smackdown, but oh my gosh. Social distancing, that's what it
beyond
is.
me, I have no idea. Ah, yes,
Yeah,
I'm glad someone's. I must. Yes.
Smackdown.
That makes more sense. my brain cells, both of them were just vacant there.
Absolutely. Oh gosh.
Thinking about cats.
Yeah. Alright, number 3. Bollocks. Scientists are not worth anymore, especially ones that make up a sorcery like our number. Deaths are below average. It's 5 weeks now. Seems like COVID has killed people who would have died anyway in a few weeks' time. Hashtag hoax. Hashtag hoax virus. Oh my gosh. Sorcery.
Sorcery. See, someone sit there and they try to learn calculus 101 and they're just like, nah, this ain't real. This is sorcery. Like y equals mx plus c. And they're just like, this is sorcery.
Yeah.
Just because you can't understand maths doesn't mean it's sorcery, you fucking idiot.
That's the thing, right? I can imagine someone, finishing their PhD and doing all this research to be like, oh yes, the R number is sorcery. Like, dude, I studied for 10 plus years for you to call it sorcery. Are you kidding me? Oh my gosh. Yeah, like I said, if you can't understand, it does not mean it's sorcery, so.
I don't disagree. The maths and the modelling is complex, but it has to be because it's quite a complex, dynamic situation that we're trying to solve for. So yeah, it would be hard.
And experts for
you probably
this.
would understand it unless it's your field.
Yeah. Sorcery.
Sorcery. Number 4. Incredible that London's R number is so low. Are they a communist state now? Great news, though.
I did not expect that.
I think this is one from one of our friends across the pond.
Are they a communist state now?
Let me I was gonna say, let me reread that. Incredible, London's R number so low. Are they a communist state now? Great news, though. I can't work out where that accent was going, but I enjoyed doing it.
Oh my gosh. I love it. And, I don't know, maybe it's the sorcery or communist.
We have to get a communist-related tweet. If you're new, every week we talk about something science-related. Quite a lot of it has been COVID because of how topical it is and relevant it is to everyone right now. And no matter whether it's 5G, whether it's vaccines, whether it's Bill Gates, whether it's the fictitious scientists who come out in support of God and other such nonsense to ferry through it, no matter what it is, there is always a tweet that links it to communism. It's the running gag of the show, really.
I know. I mean, now at least we've got the sorcery to, mix it up, but it's always communism. Are they a communist state? Oh my gosh. That's so
every week there's a communist tweet. Every time I'm like, I'm not even looking for it, but I'm just, you Yanks, you tickle me pink.
So funny. All right, number 5. I just cannot believe this. The same lying media ramping up for a second lockdown based on a fictitious R number.
So it's gone from being sorcery to fictitious.
My question is, where did this person get the idea that's fictitious? Do you know how to calculate R numbers?
To be honest, I do somewhat not agree with this post, but I agree with the misunderstanding of what's going on because of all like what I referred to with the local, the Swindon Express saying that their lockdown data was one thing, and then Brighton saying that their number was something else, and then all of them having to be pulled because they come from somewhere else completely on the RZ number. There's been so much uncertainty, and there's been such a lack of clarity regarding the R number and its error bars and how it's derived. Because if you knew you had 10 different models and that's what gives you your average and gives you your error bars, that would make a bit more sense. But if you just see your R number is 1.19, but it could be anything between 0.9 to 1.1, you think, well, how does that work? So I don't think it's that these people think it's fictitious. I think they don't understand how it changes so frequently and so in such a varied way because they're big changes.
Yeah, and I think this has to do with like what we're saying about science communication. We've seen how science really lacks
Yeah.
communication, and on the one hand, you kind of want to educate the public on what an R number is and other stuff is, and at the same time, you don't want to overburden them with information that at the same time is super essential for the context, and it's a hard one. It's a hard one. At least it's not sorcery though.
And it's also the fact that they are tough concepts. They're not easy,
Yeah, yeah,
digestible ideas to always comprehend. I don't think.
yeah.
I've spent a lot of chunk trying to get my head around some of this stuff we've discussed today. But speaking about trying to get my head around stuff, I'm trying to get my head around this fucking number 6. Prepare for the next moving of the goalposts. New cases to the R number. Pubs and shops could close if the R number rises after schools open. Countless jobs and livelihoods at the mercy of a fake, made up number about as accurate as the weather forecast.
Oh wow. Well, somebody's angry.
Mm. And and again, I kind of want to ridicule it because you're an idiot, but equally, we are having policy shaped by an average, which it shouldn't almost entirely by an average, apparently. Well, we don't know if it is or it isn't. But secondly, the idea of it being made up a number about as accurate as the weather forecast. The weather forecast is also a model predictions based on current data.
I was gonna say the actual
So it's
weather
not really
forecast
far off.
is not actually such a bad comparison. I don't think it's a fake made up number,
No.
but I think the weather forecast is actually a pretty good analogy for what it is, from what I understand. It's,
Yeah.
educated guesses, averages taken into account, and it's not wrong. It's just maybe not right in your region, or maybe, a little bit off, or maybe, so interesting.
It's just been poorly explained to people, and so much is riding on it.
Yeah, absolutely. Number 7. Saws. But this R number business, what's in it in the media for? Some imprecise indicator of whether we're fucked again or not? The purpose to set people on edge? Just tell me when I can't go out again, please. I think
Do 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 do. That's my celebratory noise because I got you to
I
say a
know I
swear
did. I'm
word.
like, oh gosh, but I'll do it for the tweet. Do it for the tweet.
I thought you were gonna beep yourself
I
out.
was going to, but I read it a bit too fast, and I was like, no, here. Well, it's out there.
Yeah, that's a victory dance. And also, SOZ,
Saws.
SOZ, not
Oh,
SARS,
saws.
SOZ,
I don't. I
not
don't ever say
SARS,
saws. So
SOZ, SOZ. So SOZ about that.
saws.
I didn't even listen to the tweet. I was too excited about you swearing.
Ugh. It's just the same stuff. Imprecise indicator. Blah blah blah.
Agreed. Number 8. They can't comment on deaths because they're so low. They can't comment on hospitalizations because they're also so low. So they decide to spread fear by talking about this bollocks R number instead. So low. So how low can you go? Low, low. Deaths. So low. I made that last bit.
Yeah, it actually ends with instead. Yeah, another
Yeah.
somebody who doesn't understand it, right? And I think it's like this is where people maybe get exploited,
It
fear
is.
mongering.
This is, yeah, it's not ridicule. It's not like the usual tweets of the week where we have all sorts of nonsense being conjured up. This is just comes completely down to people not understanding what the R number is, not being explained to them in a way that makes sense for them, as well as them seeing that the policy is being shaped almost entirely by it, and they don't understand how. Essentially,
and I think it must be tough to kind of just hear these random numbers and not really know what it means. Like, is 1 low? Why do we keep it below 1? What does that mean? What if it was 15? What would that mean?
yeah.
So we lack a lot of context when it comes to, like, what it actually means. Because even if hospitalizations were low and deaths were low, you still want to encourage the public to stay inside or to take precautions. And if that's the way they're doing it, then it's not coming across very clearly. All right, number 9. Do you know all about the 60,000 plus they said died from it? The numbers are inflated, just like the R number between 0.9 and 1.1. So you're telling me we are in the worst situation now to when it first broke out? It's all bollocks. It's overhyped.
Yeah, that's the second time you said bollocks today.
I
as
know.
well. Is bollocks a swear word over the?
No, it's kind of.
Americas?
I find it kind of charming, but I don't know. I mean, I think that you kind of rig these tweets.
It means testicles, by the way.
Oh, that's not so cute anymore. But
we do have no such gerrymandering here. Thank you very much. How dare you accuse me of such impotence?
I don't know. It sounds like you were really trying to get me to swear there in some of these tweets. So
no, I think your accusations of gerrymandering, fiddling, and impotence are disgraceful. I think they are a slap in the face of the integrity of this Burying Fake News and this very serious show, which we put out to the millions of people every single week without fail.
Awesome.
How dare you? I'm disgusted. I'm hurt, and sore, and I will accept nudes as an apology.
Oh gosh, I'm not going to comment on this any further.
I shall be refreshing my Snapchat imminently. But before I do so, let me read you number 10. Number 10 is the palate cleanser tweet, people. Number 10 is just to show there are still leaders of truth out there, and they're still willing to tweet normal things that make sense. And again, we didn't ridicule or blister too many people today. But before we get there, what was your favourite, sweetie?
Oh, it has to be number 1. I still... There's something so funny about me and my cat discussed this last night. I think
Chatting
it's
to
so
the cat,
funny.
he says, nah, fam.
And I like that. It's like, it even says, like, he only knows one person for 8 months. Who does the cat know?
Yeah.
So that one's still.
I think my favorite is also number 1. Yeah, my favorite is number 1 as well. But just so we don't pick the same thing, I'll just have a quick scan if I can pick another one that I haven't read yet. Soz, but this our number business. What's in it for the media? Some imprecise indicator where we're fucked again or not. The purpose is to set people on edge. Just tell me when I can go out again, please.
I thought it would be number 4.
It was more for the accent than taking the mic.
I
must have scrolled too fast by number 4.
Yeah.
Yeah. Yeah, incredible. When is our number so low? Are they a communist state now? Great news, though.
I thought that was really funny. That a communist state. So between that one and me and my cat are
maybe
up there.
Maybe, as I say, maybe it was someone who's just doesn't live in London, but thinks that the rest of it is communism, like someone who's Scottish. Incredible that London's R number is so low. Are they a communist state now? Great news, though.
We are making so many assumptions now.
Well, sometimes you got to work with what you got, and we ain't got a lot of morons this week, just ill-informed or unsure people who tweet without really knowing. But I digress. Number 10, Leaders of Truth. Those palate cleanser tweet. This is actually from Kamala Harris, and it's not pronounced Kamala. It's pronounced Kamala, by the way.
Ew. Well, the more you know.
Did you know that?
I did not know that.
So again, this isn't a political show, but I spoke about one set of policy, so I think it's time to say about another set of policy, and obviously President Pigshit has no policy. But this was what come out of Kamala Harris' Twitter page the other day. As president, Biden will put his coronavirus plan into effect immediately. Deploy rapid tests with immediate results. Manufacture medical supplies. Manufacture PPE. Implement a nationwide mandate to wear a mask. In his words, not as a burden, but to protect each other. And I was like, this is what we need. We need leadership and we need policy that is going to protect, prevent, and help us move forward. Not, well, the R number's high, so we won't do anything. And today it's low. Let's all go out and sleep with each other's friends, blah, blah, blah. And
I hope nobody actually said that, but
over there where it's
yeah.
It's just
No, and I think Biden also said this, and it really resonated with me. It was, this whole coronavirus. It's not about rights; it's about responsibilities. And I think we as citizens in general in the world, forget that our rights also come with responsibilities. And every time, for example, I see someone wearing a mask, I think, how lovely. They don't just take care of themselves, but they also told me indirectly that they care about me too. And we should look at, again, policies that are responsible in every way possible. So, not a political podcast, but
I agree completely. I agree with you completely. But as much as I don't like President Pig shit, I really don't like Sleepy Joe either. And it's Kamala's tweet, not his. So be gone, like an unwanted smell in the elevator. Go away. We say lift over here. But that about sums us up for the day. That about sums us up tweet of the week following another somehow episode of Burying Fake News. I hope you had as much fun listening to us as we have talking and producing this. I'm going to call it content. I don't know about great content, but content nonetheless. If you've got anything you want to reach out to us about, blah, 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 email, links in the description, check us out below. Help us stem the flow of fake news, the incessant flow of fake news, as I typically say. This has been science for non-science people. This has been science for you, the every man, the every woman, the every person. No, this is the show where we give you the ammo needed to blast the mouth-breathing, knuckle-dragging, insufferable cretins who shit up your social media and tweet crap. Be sure to follow us on Twitter and the rest of it. We're available all over the internet and wherever you find your favourite podcasts. That's all from me. It's getting tired and I'm getting late. Got it right first time that time. Sweetie, say goodnight.
Good night, guys.